Welcome, welcome to our community discussion this evening, wherever you are. This is a presentation by the Focus on Liberia in the Fortified City International Ministries. And Dennis, we're having some technical problem here, so just bear with us, and we can hear Dennis. Dennis, we can hear you.
All right, welcome back. This is Focus on Liberia. We want to welcome all our viewers from across the globe. Give us a minute and we're going to be right back. In our broadcast tonight, we have COVID-19 vaccines awareness, and this is a Focus on Liberia presentation in collaboration with Fortified City. Pastor Patient Blaze being represented here is representing Fortified City. We have our guest tonight is Dr. Joanna Kaikai, or Dr. Joanna Shaw Kaikai. This is how I like to call her. She's an infectious disease physician. Dr. Kaikai, welcome to Focus on Liberia.
Thank you. It's good to be back.
Right. This is your second time on Focus on Liberia. And we are doing this broadcast with COVID-19 vaccines awareness. This is a Focus on Liberia in collaboration with Fortified City. We have Pastor Patient Blade Atal here from Fortified City, who is going to be serving as my co-host tonight. So Patient, welcome to Focus on Liberia as well.
Thank you, Dennis. Thank you. And thank you, Doc. Thank you for coming.
You're welcome.
Our guest is based in Tennessee. She's, as I said, infectious disease physician. So, Doc, just you were here before we say welcome back. So, just tell us a little bit about when they say infectious disease physician. What does that mean, and how does that relate to COVID?
So, an infectious disease physician is one who studies and investigates and treats any organism that can infect the body, and usually that's the human body. And it can be anything from the common cold to HIV to fungus to COVID. And there, within the field of infectious diseases, there are many subspecialties, including tropical medicine, viral specialists, those who just focus on viruses, those who focus on bacteria, fungus. It's just many different opportunities to specialize within infectious diseases.
Thank you. And let me go to my co-host to start. Patient, just tell our viewers why this is important and what's the need to have this awareness program.
Thank you, Dennis. This information section, this awareness is very, very important. Looking around and listening to all the news globally and what is, what we have gone through for over the year, we can say that we are not yet out of the woods, and it is important that we maintain all the safety precautions, and we keep safe, keep our families safe, keep our communities safe. So in order to do so, there are measures that are put in place by the government of the United States of America. So in other words, vaccine has been discovered, and we need to be fully vaccinated. We want to be fully protected. And so it is important that we have this discussion to do away with some of the myths that are out there, some of the misconception, and for as many people as possible to be able to have this vaccine or to be properly vaccinated. So this is why we are here tonight, or wherever you are at the time at that particular place. But this is why we are here right now.
Thank
So
you.
stay with us.
Thank you. Thank you. So let me go to Dr. Kakai. The reason we're here for COVID vaccine, so it's all about COVID. Let's start by asking, what's the latest on COVID in the USA and also internationally? How are we doing?
It depends on which region you're looking at. In the U.S., we know overall the trend of COVID-19 infections are trending down. So that's a good thing. We know hospitalizations are going down. There have been a few pockets to pop up, but overall, those numbers are going down, especially in our older folks who have the highest chance of dying from COVID. We know those numbers are going down. Most infections occur in the younger folks, like the young adults, let's say 18 to 24. And that's where we're seeing a lot of the infections now. The good thing is that, we do have the vaccines. Looking at other spots in the world, we've heard of India and what's going on there with the number of cases rising. We've heard of Brazil and other parts, some areas of Asia, and the numbers are trending up again. We know in Liberia, just looking at the most available data, I believe it was that I saw was from the 23rd of May. Those numbers are trending down, but we still need to continue to do our part to try to get rid of COVID-19.
Wonderful. I want to ask this question, Doc. We have been hearing, news on different variant of the COVID-19. You want to just give us information on that?
Yes. So, what happened? Viruses, I mean, they're so tiny we can't see them, but they are smart, and they're frequently mutating, which means they can frequently change a little bit of their DNA. And when they change a little bit of their DNA, that becomes a variant. So they're causing similar disease, but not a great disease where it appears to be different. If that was the case, then it's called a strain, STRAIN. So we're seeing different variants. First we saw the UK variant, and then we have seen the Brazilian variant, the South African variant, and even there's one that was identified in California. And as the pandemic continues, we will see those changes in some mutations in the initial virus, the coronavirus that causes COVID-19. What we do know about those variants is that they're more infectious, which means they're more likely to spread from person to person. And we know that some of them are more likely to cause severe disease in people. So some people would be more likely to die from COVID-19 compared to the initial wild type, they call it.
So viral just keep changing.
Yeah, they mutate all the time. Like the flu vaccine, it mutates. I mean, excuse me, the influenza virus, not the vaccine, but the influenza virus mutates. And that's why each year, they look and see which strains are floating around and they make the flu vaccine to try and cover those strains, those mutated forms. The good news is that the COVID-19 vaccines, the ones that are in circulation, are effective against the current strains that are out there.
That's good. And so that brings us to the COVID vaccines itself. what are the different vaccines we have? You know, I know what are they and what are less, and then we can talk a little bit more about how they're different.
We have two major types of COVID-19 vaccines currently that are approved in the U.S. And that are being used by WHO. Also, I know there are some that are used in Russia and some other places. And sorry, I'm not familiar with those ones, but I can tell you what has been approved by WHO
Yeah.
and by the U.S. So we have currently in the U.S. the Pfizer vaccine, Moderna, and we have the Johnson and Johnson, and also currently going through phase 3 testing here in the U.S. because the U.S. wanted more data. Is the AstraZeneca vaccine, but the AstraZeneca vaccine is being used widely worldwide. And I can tell you the Pfizer and the Moderna vaccines are what's called mRNA vaccines. And then the J&J and the AstraZeneca vaccines are called viral vector vaccines. And the mRNA vaccines, what they do, they take a little bit of the genetic material from the virus, not the virus itself. And they add a little bit of stabilizers. I said they add a little bit of salt and a little bit of sugar. And that is then injected into the person's arm, and it goes into the cells and cause the cells to make what's called the spike protein. The spike protein is the protein that is seen shooting up from the virus. You just showed the video, the president's video and you saw the virus on there with those things sticking up. That's what the body is tricked into making, and then it thinks it's a virus, but it's not. And so that later, when a person is exposed to coronavirus itself, they say, "Aha, we recognize this protein, and it can attack it instead of just letting it take control of the body." And that is similar. What happens with vector vaccines like AstraZeneca and Johnson and Johnson or Jensen or J&J is all the same vaccine, just has 3 different names: Johnson and Johnson, Jensen, and J&J. And I probably go between the 3, but they're all one vaccine. And those ones use, you can call it a dummy virus. And they use the empty shell called a capsid of a virus such as adenovirus, and then they put that genetic material in that dummy virus, and then it can be added with some stabilizers, just like the salt, the sugar, and then injected into the cell, and that also produces a response. It's thought that the adenoviruses or the viral vector virus, the viral vector vaccine produces a little bit more of an immune response. And is that what may be causing some people to have a little bit, to be at risk for the blood clots? That is still being looked at. And since I jumped on the blood clots, I'll just let you know so you don't tune me out and say, aha, she said blood clots. When looking at the vaccines, the J&J and the AstraZeneca vaccine, it's been shown about, for the J&J vaccine, about anywhere from 3 to 5 persons per 1 million people who receive that vaccine may develop that serious blood clot. For the AstraZeneca vaccine, it may be 25 to 30 people who get the AstraZeneca vaccine that may develop the blood clot. If a person gets COVID-19, that's 300 to 400 people who might develop that blood clot. So you can see the risk is quite is much, much, much higher if someone was to get COVID-19 for developing the blood clots, and who's been shown to be at risk, at least for the J&J vaccine, is those young females who are 18 to 48 who seem to have experienced getting the blood clot. But again, when I was about a couple of weeks ago, I was looking up this topic to present on. And one interesting fact they found is that the number of people developing blood clots is actually on the rise, even pre-COVID. And so, and that is something they're looking at. Why are humans more likely to develop blood clots, even if we take out COVID and the vaccines? And it's thought to be probably some of the medications we're using and maybe some of the lifestyle choices that, people have made. So, it's just important that we try to take the best care of ourselves that we can. And sorry, I kind of went off on a tangent, but that was important to explain it.
And we're going to come to the more of that issue because I have questions there. But before we get there, I just want to be clear that most of the vaccines we used to is that they are introducing a form of the virus in you. You're saying it's not the same with the COVID vaccine.
Exactly. The COVID vaccines do not introduce the coronavirus in a person. What they're making the body to think is the virus, but is actually a protein from the virus. So a person cannot get coronavirus or COVID-19 from the vaccine, because the actual virus is not made and the actual virus is not introduced into the body by the vaccines. There's no COVID-19 virus or coronavirus that causes COVID-19 in the vaccines.
I have a 19-year-old, and some time ago he got infected from campus with the COVID-19, and then we were discussing vaccine, and then he said, "Oh, I'm not going to take the vaccine." And then I asked why, and then he said, "Because I already had COVID before." So, or many of the young children, they have that, perception that they don't want to do vaccine because they have been exposed to the virus. I know I'm taking us off track a little bit, but based on what you just said, I want, for you to just, go a little bit in depth of what they need to do. And then later on during our discussion, he told me that, well, I'm thinking I'm going to take the vaccine. He realized I told him that um this period, this is summertime, and there will be a lot of interaction. People are going places, they are traveling, you're going to be interacting with all kinds of people, and you need to be safe. And then he finally concluded that I'm going to have the vaccine. And also CDC has gave the go ahead for teenagers from 12 plus to begin to take the vaccine. Um, are we to tell us what is safe for them to take? Because I noticed in my research, I noticed that there's the three vaccines that are available: the Pfizer, the Moderna, the Johnson and Johnson, or it's only the Pfizer that teenagers, they are recommending for, the teens. So can you tell us a little bit more why?
Yes. So there were two different
Yeah,
questions in there.
yeah.
And we hear that a lot, that, oh, I've had COVID-19 vaccine. I mean, excuse me, I've had COVID-19 and it wasn't that bad. So I'm not going to take the vaccine, or I had COVID-19 and maybe it was bad. And now I'm protected. one thing for sure that we know is that a person can get reinfected with COVID-19. And a person can be reinfected 2-3 times if they continue to be exposed. It is thought that natural protection that someone gains from being infected may last about 90 days. But I can tell you, as the infectious disease physician for our county health department, and having reviewed several cases, there are some people who get reinfected before that 90 days. There was one case, I think it was like 35 days, and the person were like, yeah, this person, we have to say, got reinfected. And when you even look at reports from around the world, some people do get infected before that 90 days. And so when the vaccines were first coming out and we didn't have that many, remember there was the recommendation that was made that, okay, well, those who have been recently infected, you still have some protection. So let those who have not been infected go and get the vaccine. But now that recommendation has changed. If you've been infected with coronavirus and gotten COVID-19, once you're feeling better, go ahead and get vaccinated, because we cannot guarantee that protection you have will last 90 days.
That's right.
And we do know that the protection from the vaccine should last at least 6 months or even longer. That is still out. And the other question was about teenagers and why only Pfizer. And that's a question I get commonly asked. And it's because Pfizer so far has been the only one to show the data for that it's safe and effective. That is the vaccine in children ages 12 to 15. And I assume the other pharmaceutical companies are also doing research. We also know that Pfizer is now doing research on or doing clinical trials, for the vaccine on those age 6 months and older.
Oh, wow.
So, you can be confident that the vaccines are safe and effective because they're very carefully and closely scrutinized. And some people say, well, the vaccines were developed too quickly. It usually takes about 10 years for a vaccine to be developed. And that is true. But usually what takes the longest is producing the vaccine. Once they figure out, oh, this vaccine is safe, now is mass producing it because it's expensive. So what the government did, and other government in other nations, now the US did, was say, okay, companies, we will support you in mass producing these vaccines. We'll give you this money. Some took the money, some did not. But they've always been closely monitored as far as the safety of the vaccine, and are the vaccines effective. And for those young teens, age 12 to 15, for the Pfizer vaccine, the efficacy was shown to be even a little higher than adults at 97 to 99% in preventing severe disease.
And you mentioned efficacy and safety now, so let's look at that for those 3 vaccines. I deciding to take the vaccine, I will want to see how effective and how safe each of these is. Is that a factor when I want to take either AstraZeneca or Moderna or J&J? So let's talk about what's the safety and the efficacy rate.
The overall efficacy, when you put the vaccines, especially the 3 that are approved here in the U.S. together, is 89% in preventing severe disease and hospitalization. And in all the studies, no one died from COVID after receiving the COVID-19 vaccine. So they're highly effective. When the companies were going to make the vaccine, the CDC and FDA said, okay, you must show that your vaccines are at least 50% effective. And they have shown that even when you take into the various strains, um, that they're reporting efficacies of 60% or even higher. So the vaccines are effective, and for most people, they will develop some soreness in the arm. They may feel tired. They may have a headache. I think anyone would take that any day over actually getting COVID-19 and being at risk for severe disease. And so those are the common side effects. Some people with the Moderna, and I think it's been shown with the J&J, they may have some GI symptoms. They may feel a little nauseous. I think I've heard some people may feel like they want to throw up or even throw up. Um, and some people may feel dizzy. One thing I've noticed is that those who come dehydrated, come very hungry, they tend to be the ones that may feel a little dizzy or jittery after receiving the vaccine. So usually we monitor people for 15 to 30 minutes, depending on whether they've had any problem with the vaccine. Um, and Most people do well. Um, Most days we don't need to bring out, the water or the crackers or anything like that, because people do well with the vaccines. Um, and for those women who are between the ages of 18 to 48, who won, let's say, the J&J vaccine, you can just counsel them, say, there has been shown that within this age group, there have been some cases of severe clotting. Um, and I believe here in the U.S., 3 of those women did die. But the risk, again, compared to getting COVID-19 itself and dying is much, much higher, even though we want no one to die. And you'll be interested to know that at the vaccine site where we administer both the Pfizer vaccine and the J&J vaccine, people are now requesting more and more the J&J vaccine, because the J&J vaccine is one dose, excuse me, given once. The Pfizer and the Moderna are 2 doses. The Pfizer is given 3 weeks apart. The Moderna is given 4 weeks apart. The AstraZeneca is also 2 weeks and can be given 8 to 12 weeks apart.
Yeah, thank you.
Wonderful. I'd like to welcome, would like to welcome Jude. He's a community leader. He's the head of the coalition of community groups, this nonprofit in Minnesota, and also the chief executive officer for Prado. So Jude, you are welcome. And we have with us Dr. Kakai, who is giving all the answers we have been asking from the beginning of this program. Going back to you, Doc, our community, we see a lot of people, and that is one of the reasons why we are here, to create this awareness so that people can take the vaccine. There are people with underlying health factors or health conditions that have been very hesitant in taking the vaccine. So we want to bring this information to them, the reason why they need to take this vaccine.
Right. Yes, and and that's a concern for people from all walks of life. And I, counsel people about getting the vaccine every day, and including my patients when when I take care of them. And you do hear that, oh well, I have asthma, or I have underlying heart disease, or I have cancer, or whatever it may be, so I don't want to take the vaccine. And definitely, um, those are the reasons you should take the vaccine, because people who have underlying health conditions are more likely to have more severe disease when they acquire the SARS-CoV uh, 2 virus, which is the long name for the coronavirus that causes COVID-19 disease. So we've seen other things. People who are obese may be more at risk for severe disease. So please do get vaccinated. And when you go to get vaccinated, let the person who will be informing you about the vaccine, or even administering the vaccine, know your concerns. There are some people, we may watch them for 30 minutes instead of the usual 15 minutes and just make sure that they're doing okay. And we have some people who want to stay longer than that, and just so they feel comfortable, and that's fine. And no question is too silly. We recently had a lady, actually the minister, who has a phobia about needles. And my team two of the nurses spent 30 minutes with her until she felt comfortable enough to take the vaccine. And then when it was given, she didn't even know it had been administered. So, whatever your concern is, come and let us, speak to you about it. And we'll take as long as you need to answer your questions and address those concerns. And that's not only happening in Nashville. I'm sure it's happening in every healthcare center in the U.S. and around the world.
Thank you. So again, Mr. Jude Nandi, welcome to Focus on Labro. We're glad to have you. My question for you, and you can give your opening statement, is how is it in your community? What are you hearing? What's the feedback you're getting?
Yeah, thank you, Dennis, Mr. Host, and Dr. Joanna, and Pastor Patience. Yeah, I'm sorry, my system it just keeps crashing on me. So I'm using my laptop, which is not ideal for this type of broadcast, but hopefully we'll be able to manage what the system is giving me. Technology, you can never predict it. Yeah, we've been very active in the community, trying to engage them and bring it to the level that everybody will be on the same page. From the time of prevention before the vaccination to now that we have the vaccine. So every effort from the federal government down to our community has been to help people to vaccinate. And there are people who don't want to do that. Not only that they don't want to do that, but they want to poison the minds of other people who want to vaccinate. I know when I was very young back in Nigeria, we had our vaccination. People didn't ask questions. And then we all survived it all the way to US here. I'm an adult, I have children, and all my children, they have their regular vaccination, even those who are teenagers as well. And we're living pretty fine. But sometimes when politics gets into health, this is the result. And that's why we are here, to help our people and ourselves understand the value of vaccination. I don't have I'm not a medical doctor. We're glad we have a medical doctor who has the expertise to talk about the medicine, but on the social level and the community level, vaccination has been something that has been part of human civilization, we know how polio was so devastating to the world. Here in US, back in Africa, chicken pox, many of diseases that we were able to control using a vaccine. Even now that we don't have vaccination for malaria, at least we have medication that helps. That was a killer disease that's still killing up to this moment, and we're hoping that one day we get a vaccine for malaria. So, having said that, I'm impressed that our community is stepping up. Everybody is not vaccination, but our estimate is that maybe up to 80 or 90% of our eligible population are willing to vaccinate. It's not scientific, but it's just based on our, engaging the people and then also talking to those who have vaccinated. But we still need that effort to make sure that everybody who's eligible is vaccinated. So feedback from my community is just more effort, more understanding, because those who are willing and those who are on the line to get vaccination, they've gotten it. But those who have some reservation, they are still waiting. We need to encourage them to vaccinate because, as Dr. Joanna just said, if we don't get vaccinated, we have more risks of COVID and all the consequences surrounding that disease. And then we just keep pushing. It's not a very fine endpoint, but we keep pushing so that people will really step up and understand that there's value for being a part of community development. So, thank you.
Thank you. And I will come back to you to see why there's a hesitance or why there's so much misconception. But let me go to Dr. Kakai and say, we have these three vaccines. Is one better than the other, or what are you hearing from the people that are coming to take the vaccine? What are they preferring, and why will one want to take one as compared to the other?
That's a good question, and we get asked that all the time. Before I answer that, I just would like to say that you'll be happy to know that recent malaria vaccine trials have shown good results. Mm-hmm. So we should be hearing about a malaria vaccine soon. Actually, I think there have been some information recently out there. So happy to know that the malaria vaccine research and trials have been going well.
Yeah, Doug, I sorry to interject. I didn't want to mention that. I wanted you to say that as a doctor. So I'm glad that you mentioned
that. Well, thanks for the confidence. I'll say that we get asked which vaccine is better than the other. And there has been no head-to-head study of the vaccines, which means the vaccines being given in the same setting to similar people, and then you can say, okay, this one is better than the other. The three vaccines were given in different countries. Some of them there are overlap in the countries. The Pfizer and the Moderna were given around where the trials were around the same time. The J&J, those trials were different when there were more strains around. So I tell people, we tell people that the vaccines are all highly effective, and that it depends on, where you go and what is being offered. If you want to take just the, just one dose, then is the J&J vaccine. And then 2 doses, the Pfizer or the Moderna. Again, the side effects for them are similar, the most common side effects. So again, most of the time, it will depend on where you're going and what that organization is offering. Here in the U.S., we're blessed where you can go to vaccinefinders.org, and I'm sorry if you're about to hear a sound in the background, but vaccinefinders.org, and you can put in the vaccine that you want, and it will give you the locations where you can find the someone that's offering the vaccine. But overall, don't wait for one vaccine over the other. Go ahead and get vaccinated.
So, from your experience, who decides? Is it the patient or whatever is available?
Yeah, it's usually it's whatever is available, because the sometimes it's a supply issue. Recently, I was calling around trying to find someone that was offering the Moderna vaccine for a patient because we didn't have any, and and so finally was able to find a pharmacy that offered the vaccine. So again, it depends on sometimes just the supply of the vaccine and that's what's available. And then a lot of it is made probably at the federal government level, and all those details I don't know, but I know that we do have a lot of Pfizer, a lot of J&J, and probably quite a bit of Moderna here in the U.S.
Wonderful. There are some misconception concerning the vaccine. One that I have heard a lot is that the vaccine causes infertility, it causes miscarriages and all that. Is there any truth in that?
No, there's no truth. And the vaccine does not go anywhere near affecting a person's reproductive organs. So, and it does not interfere with those cells, whether it's the ova or is the sperm. So it does not have any negative effect on fertility. And then as far as, what was the second question? I'm sorry.
Oh, infertility and miscarriages.
Miscarriages, yes, thank you. So there has been no evidence of miscarriages in women who are pregnant. Excuse me. When we first started administering the vaccines, because they were not studied specifically in women who were pregnant, it was to be careful. But there were women who became pregnant while receiving the vaccine, and these women were followed. And the hundreds of thousands of women so far that have been pregnant and received the vaccine, their babies have developed fine. There's been no increase seen in women who had the vaccine and had miscarriages versus those who didn't have the vaccine. Is more likely for someone to have COVID-19 and have a miscarriage when pregnant than a person who does not have the vaccine. So I guess the simplest way of saying is no, the vaccines do not increase a woman's risk of having miscarriages. It does not increase a person's risk of having a child with birth defects either.
So let me come to Jude, and we're talking about this misconception. What do you think of this vaccine? You and I remember we took vaccines I still got a big mark here. Why is there so much misconception? What do you think is responsible? Oh, Jude, you are kind of muted. If you can unmute yourself.
Thank you. Number one to me is politics. Vaccination has been injected into politics here, and it has spread all over. So people who see vaccination means something in a different way. Some will go for it, some will not. Some others, because of their ideology, don't want to be vaccinated. It could be that I'm a strong person, I'm a strong man, nothing will happen to me. It could be that because my mentor, somebody I'm looking at, or my leader doesn't believe in vaccine, therefore I'm following my leader. It could be religion. It could be just some of the social current affairs, something on the news. I remember in our networking WhatsApp group, shared somebody was shared a photo, a video of saying that she had reaction to vaccination, and she was saying, "Don't take vaccine because look at me, look at what's going on me." But the video doesn't show the person's name, the origin of the video, how they found out that it was caused by vaccination. Nothing. It just video, and it could be someone making up. It could be true. It could be anything. But these are the things that drive narratives, what the society hears and believes, and it has no merit. So if somebody has a reaction because of a severe reaction because of vaccine, and it's not documented and nobody knows about it, sharing something like that and people consume, and once people hear it, they would like to share, they would like to talk about it, but it's unfounded. So these are some of the things that when people hear, they become hesitant to take vaccine, especially when there is no way to prove what they are hearing or to validate what they are hearing. It's just because my friend told me, I heard it in school, I heard it at a place of work, I saw it in WhatsApp, on the internet, so different sources, and then people just consume that. So especially when it's negative, that's some of the things I see that drive this, which is very unfortunate. And people should take vaccination because it's good for us, it's good for the society. And I heard, I think I don't know if it's from CDC or from other sources, where they are saying that those who don't go, those who don't vaccinate should not depend on those who vaccinated to protect them, because the virus may not disappear in a second. It might be for a while, and the impact could be, I mean, even if we approach some level of vaccination, it might still be lingering out there. So the earlier we vaccinate, the better for all of us.
Thank you. Dr. Kaka, go ahead, patient.
Yeah, I want to talk to Jude. In our community, in the different groups that we are part of, especially on the social media, because we find out that most of this misconception is spread through, the social media. What are the advice you have for those that are heading those groups and those that are heading those different platforms? What can they do to help? Because this thing is being spread, like you rightly said. I saw that video about the person they took the vaccine and this was the side effect and all that. And you see those things every day, every day. And we are part of different platforms on WhatsApp, on Facebook, on the different social media platform. What advice will you have for those people that are heading? Because as a head of the platform, you have control. You have control to restrict. You have control to pass on the right information. Oh goodness, sorry. So my question here is, Jude, what can you tell them? Because this is a global village, and the information, the safety information need to be passed on to every one of us. And all of us have to work together to make sure we are all safe.
Thank you. So when it comes to social media, especially WhatsApp has no control. At least Facebook can sometimes intervene. If you post something that's very unfounded, Facebook can actually take it and intervene. Some other social media have better control, But WhatsApp is so informal. There is no control. That's the biggest problem as I see it. And what I do is that and what I advise people in any group you belong to, you should know the reason why you should be in that forum, WhatsApp group. Let's just focus on WhatsApp. So you should have the reason why you should be there. That's number one. If you can't control what's happening there, and you don't have your voice is not being respected, that it might be that that place doesn't belong to you. The what we see there, one thing is that most of the groups I am, where I am admin, if I see that type of post, one, I'll tell the person who posted it to get down. And then I don't post things like that. I know not everybody is not me, but if something is unfounded because somebody made a video, maybe 2 minute video, use phone, that doesn't make anything. Somebody can claim anything. So for the fact that somebody posted it doesn't validate that. It doesn't add value to that. All it takes is just a 30 seconds video and then post it, and that's it. It costs them nothing. There's no validation. There's no experiment. There's no analysis. There's no feedback. There's just nothing. So if people see it from that point of view, and they say, okay, this video I'm consuming, how am I sure that what this person says is true? Because anybody can make up something. So it's something that I bring it up in the forum where I belong, and I tell them there are things we cannot consume. If it's a free forum, I can't stop people from posting, but I keep advising. And in some cases, if I'm admin and people keep posting that way, I take them out. And if you can't control, and then you don't enforce, and you're not admin, then possibly that forum might not be for you. So this is not vaccination. We're talking about vaccination. But one thing I tell people, WhatsApp is not good for Africans. It's not. It consumes our time so much. We indulge in things that are not true, founded. We belong to so many forums, and in most cases, they don't add value to us. So it's just that people, they keep forwarding. In fact, at this point, if I see anything forwarded without any text explaining, I don't open it because I don't know what is there. It might be graphic, it might be offensive, it might be a worm, it might be a virus, it could be anything. So, I'm just saying this in general. What we have, WhatsApp is taking our brain away. It's taking our intelligence, our normal reasoning away from us as a society. And the Americans invented WhatsApp. It was sold for about $20 billion to make money from others. Facebook is making a lot of money from others. And who are the primary consumers? As far as I know, Africans consume WhatsApp more than other people. And people have to, it has some relevancy, but people have to just take it because it's a pinch of salt.
Thank you. Dr. Kaka, let me come to you on the misconception. You yourself, you administer the vaccines. What are you hearing from your patient? Why people are coming to you to vaccinate, and why other people not coming? What's the deal here?
So I'll say that before I address that, I'll say to be transparent and is that yes, there's been some confusion at the start of the pandemic. And I hear that from my patients too. And they'll say, well, 1 minute you all say something, the next minute you say the other. And I say that none of us have lived through a pandemic before. And one of the great things about medicine is that, as we learn things, sometimes we have to change our practice. So as, when the pandemic first started, there may have been a little bit different information. And then as it progressed and we started to understand the virus, we could give more specific directions and information. So there may have been some confusion in the beginning, but we shouldn't let that stop us from getting the vaccine. And as Mr. Jude said, that you want to use trusted sources. A lot of what I hear is that I'm concerned about the side effects. And I tell them for most people, the side effects are going to be that sore arm. You might feel achy for a day or two. And if you feel achy, you can take Tylenol, you can take ibuprofen, or whichever medication you usually use for some pain. And you can continue to go about your daily activities. People may feel sleepy or drowsy. Um, and also, some people, they say, well, I am healthy, and so I don't need the vaccine. And we, addressed that already. There are healthy people who are dying from COVID-19 or being having to be hospitalized and be there, for quite some time, needing to even have some rehab afterwards. Um, the other thing, we hear is we don't know what's in the vaccine. And we the best we can do is to tell you what's in the vaccine, and trust that you can see that millions have gotten the vaccine and are doing well. Um, and then there's just the distrust. We know in science there have been things that have happened, especially in the African American community. There have been some injustices done in research. And we try to reassure that there have been so many eyes on this vaccine process. And even some of the people involved in the vaccine production are people of color. So you can rest assured that the vaccines are safe. They're and that they're effective, and that we're actually giving you what we said we're going to give you. There's not salt water or something else being put in the vaccine. Um, and then as far as going back to the report of the side effects, we want to encourage everyone to, if you experience any side effects, to go ahead and let a provider know. You can even stop by the vaccine center and let them know what you experienced. And if you're here in the US, and then it may be available in other parts of the world too, there's actually a phone app. And I think most people around the world have a cell phone. A phone app that when you go to get vaccinated, they should inform you about, and that you can go on and enter that information. And they each day you get a notification, hey, how are you feeling? And you put in that, and that way to check too, to see, are there any side effects that they're missing, or are there, and that's how also they can come up with, oh, this side effect is more common than the other. So that's important for as healthcare providers, and also as patients, that we access those apps and those other databases that are available to document our side effects. For those who are of the Catholic faith, we hear that, well, I don't want to take the vaccine. I think I've even heard that some of the priests, I know there was one here in Nashville, Tennessee, who was telling the parishioners not to get the COVID-19 vaccine because they had fetal tissue in them. And the Catholic Church has said, whatever vaccine is available for you to use, go ahead and get it, and to help save your life and the lives of others. But back to the fetal tissue, none of the vaccines are developed using fetal tissue. You find that all over the internet, but that is not true. The J&J vaccine were developed using cells that have been reproduced for 40, 50 years in a lab, that were originally taken from fetuses that were aborted back in like the 1950s, 1920s. And so those have been reproduced over and over in the lab, that they're not even, they have no resemblance to those cells. You can say they're lab generated cells. So you don't have to feel guilty that, a fetus died for you to get the vaccine. That is not true at all. And then I was recently on a educational webinar for one of the Nigerian associations here in Tennessee. And a lady said, well, she drinks her ginger and her other herbal supplements. She drinks that every day, so she doesn't need the vaccine. And I said, it's great that you're drinking that. That's fine, but still do get the vaccine. You want to keep yourself as healthy as you can, but that does not mean you should not get the COVID-19 vaccine. And she said, oh, you mean I still should? I said, yes, you should. So yes, go ahead and keep yourself healthy. Get the other vaccines too that you need to. Brother Jude talked about chicken pox, and as adults we need the tetanus vaccine, and as children we need all these other vaccines that help keep us well. So go ahead and get those vaccines also.
Thank you. Ladies and gentlemen, if you are just joining us, this is Focus on Liberia in collaboration with Fortified City. We are bringing you vaccine education and awareness. My guest, Brother Jude Nandi, who is joining us, a non-profit professional and a community leader. Also, Dr. Duana Shaw Kaikai, an infectious disease physician. At this time, let's get our viewers involved to read their comments. This comment is from on YouTube from Rashid Billy. He said, say no to the evil vaccine. Stephen Parker, hello, my name is Stephen. I'm watching from Monrovia. And so, Jude, you are laughing. So keep the comments so you can respond. Let me read more. This one from Bataki Azananta, we call him Thomas. He said, they are having us a virus that we didn't ask for and also impose a vaccine upon us. Here we are now. We Black people are happy to talk about getting vaccinated. Thomas continued, good for you. Now you can go to church and thank Jesus for saving your life. Hallelujah to that. Abby Tyler said, Dr. Kai Kai, can you speak to those who are concerned about long-term effects? Because we can only speak of what the studies show now. Many are hesitant about what could occur years from now. Those are a few of the comments. Jude, let me start with you. You were the one laughing at the other comment.
Yeah, there's no evil vaccine. And likely somebody who, I think Rashid, I don't remember the name, maybe that person has taken vaccine at one point in his or her life, even without knowing, or maybe through the parents. So I'm not a medical doctor for sure, but I know that there are some medication that pregnant women take that have impact on the fetus. So there are so many things we don't have control, and there are so many things we don't know, but we still do them. I don't expect myself. I'm not a virologist to know what is in the vaccine, but I know that it has worked for hundreds of years, and I've taken a lot of vaccine in my life, and I'm fine. So people can say anything. Yes, they can call it evil, they can call it any name they want. It's freedom of speech, but we're talking about lives. As we can see in the United States, when we are almost 200,000 cases of virus infection, COVID-19 virus infection daily before. But it has reduced, I think, to 40,000 nationwide now. So that's like a plunge of 80% because of vaccination. Also, the death rate in the country has seen maybe up to between 70 and 90% drop. So this is for real. So can we just imagine that there was no vaccine, and then with the rate this virus was going, you know, can we imagine where we'd be today? So that's why I'm laughing. So we see the impact of vaccine is working. There's no hiding of this fight or anybody making it up. Because if there's no vaccine, would have been worse off. And the other person said, "Thank Jesus." Yes, we're thanking Jesus for the vaccine, and it's working pretty well.
Thank you, Dr. Kaka. Before you come in, let me put two more comments. Patrick say no to big pharma, and he also say don't be a lab rat.
Oh, sorry. Can I just come in on the big pharma? I do
Yeah.
hear that from Nigeria and many other African my brothers and sisters. So when they talk about, they said, "Oh, the virus was invented for them to make money." But I'm an engineer, and I'm also pretty good in business. So I have MBA. So if we look at the cost of this virus to the world, it runs into, I think, $10 trillion. That is a heck of money. That's more than the entire African GDP combined. So if Moderna, Pfizer, and Johnson & Johnson, how many billions have they made from this vaccination to compare to the losses we had from airline flight, from a cruise, from a production facilities that were locked down, from transportation, car makers? People should know that none of these industries have any stake in the big pharma. They don't have any stake in the vaccine. They don't have any, even if they have shares, anybody can buy any share, but there's no direct linkage to other industries that suffered so much. Restaurant, anything you can think of that runs into trillions of dollars. So how can the whole world conspire to say, okay, Johnson, go and make billions? Why I close the Delta airline will just shut off their flight, and then the Carnival cruise will shut off their cruise? It's not possible. I mean, it's just everyday common sense. And I'm surprised what people believe, but for me, I just wanted to address that because this is something that I've been talking about in the community. There's no way the whole world will conspire for the big pharma to sell vaccine. Why their own industry? I mean,
why
people die?
Right? Yeah. So in the world of capitalism, everybody's looking for their own profits. So there's no way the whole industries will close down just that one industry will make money. It's not possible. Economically, it's not feasible. So people stop believing.
That's a good point. Like the whole world conspire for Bill Gates to put a chip into you.
Yeah.
Bill Gates make money, but Southwest doesn't make money. Dr. Kaka, your reaction to the comments?
Yeah, the comments don't surprise me. You know, there's something we hear all the time. I'll tell you, when we started offering the J&J vaccine, we got calls to our health department saying that we were out to kill Black people. And we're like, okay, we're offering Pfizer and we're offering J&J. Why are we out to kill Black people? So, the misinformation is out there, and we can do our best to try to dispel it. It would be interesting to know why the gentleman considers the vaccine to be evil. There is no perfect drug, unfortunately. The aspirin you take has side effects. Those herbal teas you drink, have side effects. If you're not sure, ask somebody who has been, who might have had, let's say, cancer, and the doctor advised them, don't drink this and this and this, because they can have some effect to thin your blood and to do other things. Right. So even, herbal supplements, like I said, have side effects. You say one of the gentlemen said the lab developed, humans developed this virus. We will find out one day, hopefully, but the virus is here now. As Brother Jude said, what are we going to do? We have vaccines that have been found to be safe and effective. And so, why not take the vaccine? And a lot of times I'll hear too, well, I'm waiting for my brother to take it or my cousin or somebody I know to take it. And I'll say, well, why don't you take it? And then you can tell them about your experience and you be that ambassador to get the word out about the vaccine. One of the audience members said, go to church. Not only to go to church, but we know that COVID-19 pandemic has had negative mental health effects on people. As humans, we're not meant to be isolated.
Mm-hmm.
And so getting vaccinated has allowed people to now come together. I know there's been, some confusion about the mask, the recent CDC recommendation about masks. But we do know that masks still work and the vaccines work. So in order for us to start to return to normalcy, let's go ahead and get vaccinated, and let's be that ambassador. Take your neighbor, your cousin, brother, grandma, to get your child to get vaccinated. We have people that come in groups because they're supporting each other. But there is no worldwide conspiracy to get rid of the Blacks or the Asians or the Hispanics, Africans. That's just not true.
Yeah. Dr. Kaka, there's another question here from Abby that says the long-term effects.
These agents that are being used, they have been used for other modes of treatment. They've been used in like the mRNA technology has been used for things like cancer treatment. We know the vector vaccine have been used for influenza and Zika virus. And even now we know, there's an Ebola vaccine that's using such vector. Yes, these vaccines are new as far as being used for COVID-19 vaccinations, but it's not anticipated that there would be long-term side effects based on what is known about the vaccines.
Thank you. Michelle?
And I will say, and the vaccines are still relatively new, but again, based on what we do know, is not anticipated to be long-term side effects.
So Dr. Kaka, the vaccine that I take today, how long am I going to be protected by that vaccination? Do I have to take it every year or every other year? What's the frequency?
That's a good question. And again, it's one of those that we will know as time goes on. Right now, it's anticipated that the vaccines will last probably at least 6 months or maybe even longer. We know now, we have those who first got the vaccine earlier in the summer in the research trials. So we're seeing some of them have antibodies, that protection of even up to a year. But is that protection high enough to prevent reinfection? I like what Dr. Fauci said a few weeks ago when he was asked, and I think the journalist asked him and said, Dr. Fauci, well, let's say the pharmaceutical companies are saying that you would need a vaccine in the fall. And he said, we will decide that after we look at the data. So it's possible we will need what's called a booster, and that would be with them trying to look and see what strains are floating around and incorporating those into a dose of the vaccine. So it's likely we might need one in the fall, or we might need one annually. For that, we don't have a confirmed answer right now.
From the text messages we saw, we know that we have a lot of work to do, a lot of work, because it is some of these statements that are being made on the internet that are holding people back from taking the vaccine. And we are seeing real life evidence right before us. So, uh, those that are watching us, you have to look at the facts, you have to look at the healthcare professional, the messages they are passing on to you. You have to look at all the information that are made available and stop, listening to all these hearsays and all the misconception around, because your safety is very important. The health of your family is important. The health of your community is important. And I'm coming back to Jude. Uh, the information that we need to pass on, Mr. Jude, the information that we need to pass on. Are we getting somewhere? Do you think we are getting somewhere with the awareness we are doing? Because we still see on the internet all that is going on. We still see people trying to discourage people from taking the vaccine.
Yes, we're making progress, but we still need more effort. The general means of communicating, like or passing information, like as we do, through Facebook Live, through Zoom and other social media or other channels, they're effective. They're helping. But as we ramp up vaccination and more people get it, we are approaching to the population that are very resistant to vaccination, and it might take more personal relationship, personal notes to get people to vaccinate. So targeting micro groups, social organizations, social connections, where people hang out, where people trust each other, small circles. That might be the next stage. So that if I talk to my wife, or if I talk to my neighbor, or somebody, my coworker, or somebody from my community I know very well, that trust and knowing that I've taken it, my wife has taken it, my child has taken it, at that level, that may add more flavor and more push to the effort.
Thank you. Again, ladies and gentlemen, you are watching Focus on Liberia. We are bringing you COVID-19 vaccine awareness. We want to thank you all so much for staying here with us. We'll now go around the room and get your closing statement. If there's any last thing you want our viewers to take away from this show tonight, please include that in your closing statement. And let me start with Mr. Nandi again.
Yeah, thank you, Dennis, for hosting us, and thank you, Dr. Joanna Kakai, Pastor Patience Blay, and all the people who made it possible, and also MDH and other funders as well, sponsors. So my closing remark is that if I tell you to go and do something and I've not done it, yeah, you might just be thinking that I just want to mislead you or I'm not being sincere. But I've taken it, and my wife has taken it, my child has taken it. Whoever that is qualified in my family and has access has taken it. So I'm just saying, do what I do. I'm not just saying, do what I tell you to do, and I'm not doing it. That's the most important, most powerful way to relate with people. And again, we should all remember that if not all of us who have taken vaccines in the past. So COVID, just because of politics, that's the driver of the hesitancy and all the noise we hear everywhere. So if not, it would have been just like another vaccination. So let's just not focus on the noise and the politics, but let's focus on the reality. Because as we vaccinate, we help our community to be healthy, and even ourselves. We have to be selfish. If I take it, it's my body, right? And I'm protecting myself. So I'm being selfish, but I'm also helping the community as well by taking it so that I don't infect other people if I catch COVID. So it's very important. It is more personal. It's just something that we're not saying. "Oh, I am a secretary, maybe secretary of state or a governor, or I have this money or have this, and I'm telling people what to do. But I'm just saying this is what I did, and I believe it's good, and then I'm saying do what I've done, and it's as simple as that. So let's get vaccinated, and let's enjoy our summer, and then be back to normalcy. So thank you for this opportunity.
Thank you. One last comment I want to read before Dr. Kakai comes on is Aku Joseph Kolmasi, and one of the people that were sharing whatever I saw on Facebook about COVID-19 stuff. But I have managed to take my first dose.
Good news.
Thank you, Kakai. Your closing comments.
This is the stage where we have to work the hardest, as Brother Jude said, to get our friends, our family, our co-workers to be vaccinated, because it not only protects them, it's going to protect the everyone else, because it used to be that one person could infect up to 6 people without even knowing it, having COVID-19. And so in order to hopefully one day get rid of the SARS-CoV virus that causes COVID-19, we all have to do our part and get vaccinated and help each other for our physical, mental well-being. And, as was said, we're not only telling you, we also have gotten vaccinated. And 2 weeks ago, my 15-year-old got his first dose of Pfizer vaccine, and he did fine. So let's go ahead and get vaccinated and share your experience about being vaccinated to others. If you have any concerns, you can go on the CDC website and read about the different vaccines, or even the WHO website and read about the different vaccines. And like I say, you can go to the vaccination site also. And when you get there, all your questions will be answered. And thank you for this opportunity to, speak to you all and with you all about a very important matter.
Thank you so much, Doc, and we appreciate your time. Pastor Fisher?
Yeah, to our viewers out there, I want you to know that the CDC is concerned about your health. The Department of Health is concerned about you. The community is concerned about you. Your family is concerned about you. So that is the reason why we want all of us to be vaccinated, and we are all protected against this deadly disease. And I believe, like all of us have stated here, when you are safe, your neighbor is safe. So go out there to the nearest vaccination center, get vaccinated, encourage your family members that are hesitant so they too can be vaccinated. And we will be bringing to you more information on some events that will be taking place close to us or wherever we find ourselves at this time. So we want to say thanks for watching us. And this has been a wonderful presentation. I want to thank Doc for being part of it. And we hope to see her again. And thank you, Jude. You have been wonderful. He's been working hard in our community and with the rest of the coalition that are working along with us to spread the information about vaccination. I want to say thank you to you guys also. And to my wonderful, wonderful host, Mr. Ja, who is always there to help us spread the news. I, I say thank you. And God bless you.
Thank you so much. Thank you. Thank you. Thank you. On that note, I want to say thanks to all our viewers. Thanks to our guests. Until then, my name is Dennis Jar on behalf of the network saying good night and God bless you.
We all love you.